I'm Shawnte Spriggs. It was a very unique way that I came upon my diagnosis. I was at a women's conference at a friend of mine's church in Lynchburg, Virginia, and we hadn't seen each other. He invited me, and during that women's conference, they had screenings for cervical cancer as well as HIV, like the pre-screenings. And she tested me, and we went out and waited for 10 minutes. And I said, "This is like great. You get your results in 10 minutes." Before, I would normally have to wait about 2 weeks to get my results. And then she called me back into the room and she said, "We're going to have to test you again because it picked up HIV antibodies." "What do you mean HIV antibodies? What is that?" And so she tested me again. And so that's how I came to find out. And so I remember immediately I went through my life is over. Like once all the emotions settled in and the internalized stigma, no one is going to know me as Shawnte no more. It wasn't until probably later on that evening when I told my daughter the emotions sat in. And that's when the adrenaline pumped down and I was able to realize, okay, my life has just completely changed. And I became almost, I wouldn't say numb, I became limp. But I would probably say I went through a series of emotions later on that night and that evening, probably for the next week. Later on that evening, I contacted my son, of course, my husband right away. Of course, the pastor knew right away. I told my family immediately. I remember contacting my manager right away. I knew, as strong as Shawnte normally is, and I've gone through a lot of things, this was one I could not handle on my own. It wasn't easy. It wasn't easy. I wish that the time frame for newly diagnosed people would be longer in a doctor's office. I remember my time frame with my infectious disease doctor being anywhere between 15 minutes, which that's like the norm. But for a person that's newly diagnosed, you're trying to figure out all the questions, ask everything, process everything, but still deal with the stigma that we normally face. It's just some things that I wish from a clinician standpoint, the information would be a little bit better at the beginning and be more proactive versus, okay, now we're reactive. This is the situation. This is your diagnosis. And I remember at the time, my diagnosis was September. I didn't get an appointment until January, 4 months before I drove up to a place where on the top it said Infectious Disease Center. And I said, whoa, I'm here. And I think that's when the externalized stigma became really internalized for me because I said, wow. I remember there was a big, like, new hospital they had built across the street because I went to Charlotte. I was living in Greensboro. I did not want to go anywhere in Greensboro because I knew so many people there. So I opted to drive almost 2 hours away. The amount of care that I received once I got there was something I've never seen before. And that has been kind of the theme ongoing. I just wish all the clinicians would talk to each other, if that makes sense. I would say instead of just meeting us where we are with the immediate need. I understand someone newly diagnosed. Let's find out where they are. Let's get them a CD4 count, their viral load, and let's go ahead and get them on medication. But also, let's go ahead and give them options. Let's show them there's other things that that can continue their life and whatever their goals are, even if the clinician doesn't necessarily have the time, because I understand that they're busy. They have very tight, time restraints. Maybe perhaps having a nurse or even having peer support in the doctor's offices. So, hey, immediately after your appointment, if you have 15 minutes, Miss Briggs, we have someone that would just like to talk to you about some of your life goals, because life doesn't end here. If I had just heard that instead of having to figure it out, just something there. And then that person because we have peer support and peer navigators and CBOs, community-based organizations, and community centers and community spaces. There were so many myths out about HIV. I just thought I could not have children anymore. Because of that, I immediately, I think about a year later, I ended up getting a full hysterectomy because I was already going through some challenges and there were other options out there. But I said, hey, I can't have kids anyway. So I'm just going to go ahead and just opt for the hysterectomy. And that's what I did. I wish I probably would have known, not that it would have changed too much, but I like having that choice. I like having that option. Now I know where to go. I know where to look. I go to CDC. I know where to find the resources. But at the beginning, there were so many resources. And differentiating, filtering out what's fact and what's myth, that was just a lot for me to process while I'm still trying to understand how long do I have to live? Because I didn't know how bad off, or either in my case, how good off I was until 4 months later.